we decided to do our health topic on stroke. Stroke is the fifth leading cause of death in the United States. It causes serious disability in adults and is sometimes called a brain attack. Stroke can cause long-lasting brain damage, long-term disability, or even death. The two types of strokes are ischemic and hemorrhagic. Ischemic is when blood clots and other particles barricade the blood vessel to the brain. Plaque can cause blockages by building up in the blood vessels. Hemorrhagic is when blood vessel bursts in the brain, blood builds up and damages surrounding brain tissue. Prenatal ischemic stroke is the most common in children. It occurs in 1 every 2,800 live births, and it develops as often as brain tumors. It's in the top 10 causes of deaths in children ages 1 to 19. In most cases, a cause still remains unclear. Strokes can transpire prior to birth, right after birth, or a few months after birth. Any stroke that appears before age 18 is called pediatric stroke. Only 60% of children who survive a stroke will have permanent neurological problems. 140,000 Americans are killed each year. Every 40 seconds, someone has a stroke, and every 4 minutes, someone dies from it. Each year, over 795,000 people have a stroke in the United States. Almost all of them are ischemic strokes. Each year, the amount of strokes in the United States costs an estimated $34 billion. Stroke is the leading cause of death for Americans in the United States, although African Americans have the most deaths from it. Hispanics have seen an increase in death rates since 2013. In 2009, people who were less than 65 years old were hospitalized due to stroke.
Statistics continued. A perinatal stroke occurs between 22 weeks during pregnancy and 1 month after birth. Signs and symptoms are subtle, so it's often missed. A stroke that occurs after birth is known as neonatal or a newborn stroke. If it occurs prior, it's known as fetal or in utero. Signs and symptoms may be overlooked for months to years when a baby has a stroke. There's a very low risk of a baby having another one, and it's less than 1%. Common medical conditions can increase chances of stroke. Previous stroke or ischemic attack raises high risk of getting another stroke. High blood pressure, cholesterol, heart disease, diabetes, and sickle cell disease are linked to strokes. Lifestyle can affect the chances for stroke as well, such as an unhealthy diet, physical inactivity, obesity, high alcohol consumption, tobacco usage. Stroke can come from genetics and family history as well. When people get older, risk of stroke is higher, and it's more common in women than in men. How to lower stroke risks. Taking aspirin can help diminish the risk. Controlling blood pressure is a great way to lower risk as well. Controlling cholesterol and smoking can also raise the risk for it. So the best thing to do is to either quit smoking or don't start in the first place. In conclusion, if you believe someone is having a stroke, you should call 911 immediately. Don't drive to the hospital. If you see a person having a stroke, they should be aware of the time that the symptoms started. If a person is unconscious, check breathing and pulse. If necessary, start CPR. Stay focused and take actions to help, because when someone's having a stroke, the sooner that you start responding to their situation, the better the turnout can be for them.